may know, I'm running for city council again, so we don't really have any other way to sort of publicize things, so I'm taking this opportunity to sort of explain some of my positions to the community. The one I wanted to look at first was the city's overall response to coronavirus. I'm a little critical on the overall response. I know you sent a lot of letters. I looked today, and most of them are dated back in April. Writing to our senator and our congresswoman and I think the governor's office. What I see, and to be positive, is a lot of focus on the business community, the financial impact, the loss of revenue to cities based on activities going on. What it seems to be missing is more of a concern for the actual human toll, the human cost of people getting sick and dying. I guess part of that's indicative of our healthcare system. It doesn't really focus on, it's focused more on for-profit and individualistic and focused on diagnostics and therapies. It's not at cost and universal and focused on prevention and wellness. So this pandemic has really challenged our whole notion of community health and public health. So I mean, that's hard to deal with, but what I keep on asking with your Facebook posts is, where can we get tested and how much does it cost? Because that to me is the first step in controlling this issue, and that's not really talked about. Other people will explain, or they'll say Marquee Health has tests and you need insurance. But I remember our Congresswoman, Katie Porter, dragged the CDC director over to Barrel way back on March 13th and got him to commit to free testing for all Americans, regardless of health insurance. That is now 5 months ago, and we're still where do you get tested? What's going to happen when we go back to schools? Part of the whole pH metrics looking better and the 14-day wait is that it sort of assumes as people get sick going back to school, we'll be able to test people, we'll be able to isolate. I don't think that's going to happen. So I'm hoping, like everyone else, it gets better, but I just think the city could focus more on that aspect and looking at the issues of actual public health along with wearing masks. I'm glad you're finally wearing masks. That's great. I think that's here to stay for the long term. So that's my position, and we'll look forward to doing more of that next year, particularly if I win a seat on city council. Okay, thank you. Bye.